Okay. So I want to introduce our friends at Spectrum Management. We have Heather and Mike, and they'll be presenting today, and we'll get started. So
awesome.
Heather.
Okay. Or maybe, let's see. I'm trying space and arrow, and
oh, there we go.
I just got temperamental. Perfect. Thank you. Do you want to say anything, or you want me to jump in?
No, I'll start.
Okay.
No, like Des was saying, well, welcome to Open Enrollment. A lot of times,
Because they're recording them.
a lot of times with the benefits, everything's all right. Right now is the time that we put everything together and all that. One thing that you guys for STG, shout out for Rachel and her team, and for the executive management team. This is something that you do almost monthly. It's just so much going on to make sure that they provide you with the benefits. And with you guys, Heather and I, Spectrum Management deals with well over 300 clients all over the country. You guys have unbelievable benefits, and your company, the organization, is very generous in providing great benefits for you. So when you see Rachel, now that this thing is over, and Des and that, everything, they can now actually kind of breathe for a month or two. And then we get to start this all over again in January and tracking it. So Heather's going to go over the benefits, and then we're going to tie in some stuff, some tools to help manage your claims, your health, and all that. So go.
Awesome. Hey, so I'm sure some of you have cheated and already looked at the first bullet on the slide. So like Mike said, we're obviously managing your plan all year long. And then about 3 months ago, we really dive into really the meat and potatoes and analysis of your health plan and all of your benefits. But with medical, we've been seeing a great thing occur over the last 10.5 months, and that is that you guys have ran really well. And when we say you run really well, what we mean is essentially medical comes down to premium collected, right, by Select Health to claims paid. Right? All of the services we receive, medications and prescriptions we fill. And unfortunately, a lot of companies, and you guys have been in this boat in the past, is if they don't collect enough to pay out claims and there's deficits, that's when we see obviously rates jump year over year. Well, STG, for the first time in history, actually ran in the black, right? Not the red. And it was a profitable year for Select Health on your business. So they were able to give us an actual rate reduction because of how well the plan ran. So the fact that you're getting a rate reduction is incredible. And we're really excited about that. So what that translates to is 5% savings over current. So you're going to see a 5% reduction on your medical premiums. Okay, so when you log into Benefit Compass, in fact, that's where you'll go to look at all the benefits and all the costs for the benefits we go over today, right? And we'll remind you of that site at the end of the meeting. A couple other key things, just kind of as an overview, and then we'll jump in. And medical obviously is staying with Select Health with that reduction. We're also keeping the HSA and FSA, both with Health Equity. We're continuing to have the telehealth program with Teledoc. The one change we do have this year is we are moving the dental from Principal to Dental Select. And the reason for that is when we got your renewal with Principal, we did get an increase that we wanted to make sure was in line with the market. And also it's always good to look at other competitive carriers to see if we have the right pricing, the right packaging, and obviously the right partner. So it was determined that this year going forward, we wanted to move that to Dental Select. And there also was a little bit of savings there too. Not much, it's even almost pennies on the dollar, but it was a better decision for us for the coming year. Yeah?
So is that I have to check my dentist?
Yes, and we'll get to that. Yep. We are keeping the other benefits with Principal, vision, life, and disability, so there's no change there. And then like Mike said, in a little bit, we're going to jump into some of the initiatives for 2017 that we want to share with you guys as far as things that you can do better as consumers of healthcare, and also all your benefits, getting some tools to help you just manage that individually. So we'll go ahead and jump into some housekeeping items. So all of you in the room are obviously full-time eligible. So you can enroll in the benefits as either new hires or ongoing employees every year in open enrollment. Any new hires in the room? Okay, just one. So just as a recap then, you are eligible to join the benefits first of the month following your date of hire. You can enroll you, your family member, so your spouse to which you're legally married, and then any of your dependent children up to their 26th birthday. So you guys probably remember several years ago, it was about 2012 when this law changed, in that you didn't have to have your child be a tax dependent or a student or living with you. The law changed to say it's as simple as they're your legal son or daughter and they can be on your health plan. Yes.
You did say dependent, you didn't mean to say that.
I did say dependent, and I did mean to say that. Your son or daughter, yes.
But for tax purposes, they have to be dependent.
So what I was saying is years ago, there was a lot more rules. They had to be a tax dependent, they had to be a full-time student, or they had to be living with you. Now the law states none of those things no longer apply. It's as simple as they're your legal son or daughter, they can be a dependent on your plan. Does that make sense? Correct. Yep, that's exactly right. Okay. Now, when they turn 26, they would be automatically removed from the plan. If they got married, you can't cover your son or daughter-in-law. And if somebody was having a baby, obviously there's no grandchild coverage either. It would just be them covered on your plan. Now, open enrollment is your time to review your elections. Do you have the right people covered? Do you have the right plan selection? And the choices you make during this time will lock you in to start January 1st, okay? And the policy period for STG runs January 1 all the way through December 31st. Now, during the year, however, can you make a change to your benefit elections? Does anybody know? Yes, you can. Here's a little cheat sheet, right? We have certain life events, what we call qualified events, that allow you to make a change. So if you get married, of course, you would add your new spouse to the plan. If you got divorced, you'd remove the ex from the plan. If you had a child by birth or adoption, they would obviously be able to be added to coverage. A death, a loss of family member, or a loss of coverage, those would also allow an adjustment, okay? Now, it's really important to understand, however, these are the only times you can make a change. So you can't just go to Rachel or Des in HR or give us a call and say, you know what, I got my dental cleaning done last month and I was told I have no cavities. Can I just cancel it for the rest of the year? Okay, it doesn't work that way, okay? You're actually locked in until open enrollment or until a life event, okay? Did you have a question? Okay, wonderful. And it's really important, that bolded sentence there, you need to notify us through Benefit Compass within 30 days of the life event, okay? So if you got married on March 15th, you need to tell us by April 15th. If you got divorced too, you need to notify us within 30 days of the divorce. Now, there are certain situations like marriage and divorce where we will require documentation. So either the marriage cert, a copy of that, copy of the divorce decree, things like that, okay? So make sure that you're obviously getting that in order as well when you notify us, again, in the online enrollment system, Benefit Compass, okay? Now, if you forget to do it within the 30 days, when is your next opportunity to add or remove that dependent? Open enrollment, that's exactly right, okay? So make sure you're very in tune with that timeline. Okay, so we're gonna jump into the benefits here. We're gonna do an overview on what they are and how they work. And then if you do have questions, if you'll just hold them to the end of each section, so I'll stop and make sure that we can address those questions before we move on, okay? So the first thing to understand is our medical plan is an HSA, or Qualified High Deductible Health Plan. This is the exact same plan, same deductibles, same percentages and copays. So really I like to break it out into 4 categories, okay? The first category is our deductible expenses. So when you're looking at that column, you can see AD after everything with the exception of preventive care, right? Now, if we're having an inpatient, an outpatient, or maternity claim, you can see that there's 20% after deductible. So that 20% is called coinsurance. So those big ticket items are what we call major medical. That's the first category of deductible expenses. So outpatient means same day. Okay, so you're going to get a surgery, less than 24 hours to operate or have that done, and you obviously then are discharged to go home. Inpatient means you're staying longer, right? You're in the hospital for an extended period of time and the clock starts at more than 24 hours. And what's maternity? Having babies, right? Which we do well in Utah, okay? So those 3 categories, we have our deductible first, our coinsurance second, and again, that 20% is going to be on remaining charges. So for example, if you have a $10,000 outpatient claim, you're gonna pay the first $3,000 if you're enrolled as one person. But the second you have 2 or more individuals on your plan, you are now subject to that family deductible of $6,000, okay? But if I'm enrolled as just me and I have a $10,000 claim, how much am I gonna pay? $3,000, okay? Then Select Health will say, okay, you paid the $3,000, the remaining charges is $7,000, and because that was outpatient, you're gonna pay 20% of the remaining $7,000, okay? Yes?
Is it possible to get 2 individual plans instead of a 2-person plan?
We'll have to direct that to HR. I'm not sure what their policy is on that for married couples, okay? So then the third element to this, so deductible first, right? Co-insurance second for those major medical items, and then out-of-pocket max is the third element. Out-of-pocket max is $4,000 per person, $6,850 for family. So if I've paid my $3,000 deductible, and then my 20% on this example, right, of that remaining $7,000, both of those items, so my deductible plus my co-insurance is all rolling up to that out-of-pocket max, okay? So they're both being applied to that. Who can tell me what happens after you reach the out-of-pocket maximum? Thank you, Kelly. That's right. You're covered 100%. She said you don't pay anything else for how long? For the rest of the year. That's right. So everything resets January 1st, okay? So that's our deductible major medical. The second category is our preventive care. As you can see, they're covered at 100% in network. What are we talking about when we say preventive care? What type of office visits or exams have you guys got done under preventive care or that you know are covered? Any ideas?
I get my cholesterol checked every year.
Yeah, so the annual checkup. Thank you. That includes, like you said, cholesterol. So that's kind of the know your numbers exam, right? You get the whole health assessment. Anything else come to mind? What about children? Their well child check exams, right? Okay, immunizations, our flu shots are covered. Also once, yep, thank you. Somebody said mammogram. So once we get to certain ages, things like mammogram, bone density, colonoscopies, those are also covered, okay? Oh, of course, you've got a long way to go till you can get that, okay? Now also about preventive care, if you have a family history of breast cancer, of colon cancer, you can get authorized to get those done sooner than 50 or 55 or whatever the age is with Select Health, okay? And all you need to do is call them and work through that with them. Now our third category is what we call diagnostic care, okay? Now again, everything is subject to that deductible. However, after we meet that deductible for diagnostic, we're talking about office visits, right? We think we're sick, we're gonna go see a doctor either at primary care, specialty care, urgent care, or emergency room. And those have fixed copays. So the first one is that $15 copay after deductible. That's for primary care. Our primary care doctors are our family practitioners, our pediatricians, our nurse practitioners, and some gynecologists, okay? The other side of that, the $25 copay after deductible, is everybody else, okay? All the specialists. And the easiest way to remember specialist, ready for this? Anybody that ends in ist, okay? Your dermatologist is a specialist, your oncologist, your physical therapist, right? So that's an easy way to remember. Now, the urgent care is the Instacares, right? With Select Health, and they have the kids care unit within the Instacares at some of the locations. And you'll get a reduced discount. If you go to Kids Care, it will actually mirror the specialty copay of $25. Otherwise, you're going to be paying a $35 copay after deductible, okay? And then emergency room, you can see, is $75 after deductible. Now let's talk a minute really quickly though and contrast these three different services before you meet the deductible. If you think you have strep throat and you go to your primary care doctor and you get a strep swab, a blood workup, and a urinalysis, we know we're gonna pay $15 after deductible, but if you haven't met the deductible yet, what can you expect? So what's gonna happen is your doctor will bill Select Health and say those three things were done. There's codes associated with each one of them, and each code has a price, right? And there's allowed amounts that the doctor can charge you based upon their predetermined fee schedule with Select Health. So they're contracted to only charge you certain amounts, and that's why they're in-network doctors, okay? So maybe they're $20 each. So the allowed amounts is $60. However, if you went out of network, you can see there that you have higher deductibles, more co-insurance, but you also could be balance billed well and above the allowed amounts that in-network doctors have, because what's the deal about out-of-network docs? They're not contracted, right? So they can charge you really whatever they want. So please understand that before you meet the deductible, you're still getting 20 to 30% discounts on your services. And those again are what we call the allowed amounts. And the doctor cannot go over those. So if my bill is $60 from my primary care visit where I thought I had strep throat, the doctor bills Select Health, I get that EOB, or explanation of benefits, in the mail, right? That tells me that it's $60, and then how do I pay for that $60? Out of my HSA account, okay? A few of you said that, that's exactly right. And how much is applied to my deductible? $60. 100% of the $60, there you go. So the $60 is what's applied to the deductible. So before you meet the deductible, that's how you're meeting it with office visits. If it's not like a $10,000 claim, right, where you hit it all at once, you're essentially chipping away at it all year long. And as a family, if you're subject to the $6,000, you're doing it as a collective effort, right? So maybe it's a $1,000 claim here, a couple of primary care visits here, a few prescriptions there. All of those amounts are going to go towards that $6,000 first, and then the coinsurance kicks in after. Make sense? So the sum of services that make you satisfy your deductible can obviously be vastly different depending upon how you use your health care throughout the year. Does that make sense? Yes? No. So that's a great question. The copays go towards the out-of-pocket maximum as well. And once you hit that out-of-pocket maximum, every single service, prescription, office visit, every single thing on the plan is covered 100% for the rest of the plan year. Yes?
Two questions. First off, if you're on a family plan, you're subject to the $6,000 deductible.
Correct.
Let's say all of my family's perfectly healthy, no medical expenses, it's just me that has to have surgery or something like that. And am I just subject to the 3 or am I subject to the 6?
Great question. So the 6. So just, I'm going to restate your question so everybody can hear. If one person in the family has a big ticket item claim, would they be subject to the 3,000? Like, is it a 3,000 per person, or the 6? And the answer is the 6,000. Okay. So it's not a per person deductible within the family. It's 6,000 for everybody, whether it's met by one person, 2 people, or the sum of many. When and if the 6,000 is met, the 20% or the copays kick in for everybody. Okay.
My second question is, when you go to an office visit and they say, okay, that'll be $25 or whatever for your copay, does that get taken off of your EOB?
So great question. So sometimes we're going to the doctors and they're telling you, you owe us a $25 copay. Here's my advice. Your plan does not have a $25 copay. So what I would say is tell them, I will pay you once you bill my insurance because I'm on an HSA plan. And then we hear some examples with doctors' offices saying, well, we have an office policy, see the fine print on the wall, that says you have to pay us $25 for us to see you. If that's the case and you pay $25, it's not a copay, consider it a down payment, okay? So if you get allowed charges of $60, you're gonna subtract $25 from that and obviously pay the difference, okay? Now we hope that the doctor puts down that you already paid $25, but to be honest, sometimes they don't. So I would really encourage you, if you're doing that, make sure that you're keeping your records in order so you're not overpaying and getting an excess amount of credits on your account with your doctor. Make sense? Okay. So prescriptions is the last category. Again, subject to deductible, and we have 4 tiers. And then after deductible, we have copays. Tier 1 are our generic medications. Tier 2 are our brand name drugs. Tier 3 are also brand name, but they're called non-formulary. All that means to you is these are more expensive drugs on the market. A lot of time they're newly on the market, so they're patented, so there's no competition, there's no generics or alternatives, so they're just more expensive, right? And it passes more cost on to consumers. And tier 4 are the specialty medications or the self-injectable meds, okay? And that's a $100 copay after deductible. And we'll talk a little bit more about pharmacy tools here in just a little bit. Mike's going to go over some ways that you can shop, because as you guys know, hopefully by being on the plan, one medication, whether you fill it at CVS, Walmart, Costco, or Sam's Club, it's going to have 5 different prices, right? So you obviously have the tools available to you to say, okay, I know I need this medication. Where's the best place I can fill it for the best price? Or maybe I'm taking a brand name drug and I want to know if there's a generic out there or an alternative med out there. And to be able to have that information at your fingertips to then go have a conversation with your doctor to say, hey, doc, what do you think about this generic instead of the brand name? Still meeting your medical needs and saving you money? That's a win-win, right? So these tools will help you do that. And somebody asked earlier about the dental provider directory, but just a reminder for the medical, selecthealth.org, okay? Or your mobile app that we will address here in just a little bit. You can access provider searches there as well. Yes?
There's not a separate deductible for prescription prescriptions, right?
No,
That goes
that's,
against your.
yep, none. Yeah, so it's one collective deductible for every single service.
So if you've met out of pocket for the year, any prescriptions
Are free for the remainder of the year. And it is worth mentioning out of network, I don't want to go over every single line item, but again, there is no copays except for emergency room, because that's the same no matter where you go, but all the other benefits are just straight 40% after that separate higher deductible. So those are not cross-cumulating. You would have a separate in-network deductible and a separate out-of-network deductible. So very costly to you. So stay in network, of course, if you can. Okay? Okay. Yes?
So with expensive meds, you still have to pay for all the medications up to $6,000.
Correct. That's correct. Yes. Okay, so the HSA, we're continuing another year with Health Equity. All of you that are currently enrolled and have existing debit cards, do not throw them away, okay? They will just get reloaded with the new contributions for 2017. Health Equity only issues cards to new members or once existing members come up on their expiration date, okay? And then that's when you'll get a new set of cards. And also STG is continuing for another year to fund the same exact amounts that they did for 2016 for 2017. So very generous contributions that you're getting. Let's review those really quickly. You can see for if you're enrolled as one person, you're getting $152 per month or $76 per paycheck. Two party is $292 a month or $146 per paycheck. Family is $329 a month or $164.50 per paycheck. Okay. Now what you put in and your employer, so it's the sum of both parties, cannot exceed the IRS's annual contribution limits. Okay. So this is the maximum amount you can put in. As one person for 2017, it went up just $50, okay, to $3,400. If you're enrolled as two or more, remember you're subject to that $6,000 deductible. You can put in $6,750. And if you're 55 years of age or older, it's an additional $1,000, okay? Now we've got asked this question in every meeting, so I want to make sure that you guys understand. If STG is giving you $329 a month, what's that times 12? Whatever that number is, subtract that from $6,750, right? And then that would give you your total annual amount that you can put in through payroll pre-tax. And even if you obviously want to divide that per pay period, that's what it would be. And then when you go into Benefit Compass is also going to calculate it for you and tell you, okay, if you do this much per pay period or this much per month, it also will calculate and prorate that for you annually. So you can see that there too. Yes? It's the account holder, okay? So great question. Since you brought that up, I'll give you a little, this is a workaround. So his question was, what if you and your spouse are both over 55? This is a glorified bank account and your social security number. It is a banking asset, okay? So the account holder, once you're 55, you can throw $1,000 into your HSA. I've seen this a lot where both spouses are over 55, open up a separate HSA. You can just do a direct HSA with Health Equity that's not employer sponsored. It is about $3 monthly fee to have that, but then you can fund that person's $1,000 pre-taxed into their HSA, okay? But it would obviously be separate from the company, okay? So a couple key reminders on the HSA. Obviously the money going in we mentioned is pre-taxed, right? So state, federal, and FICA exempt, huge advantage to you. Can you adjust your contribution amount anytime throughout the year? Yes, you can. Okay, you can start it, stop it, decrease it, or increase it anytime. You also cannot be covered on any non-qualified plan, okay? So we've had some people that have been on military care before. If you have been on VA benefits, TRICARE, or DOD, come talk to me, okay? Because there's just an elimination period before you can actually have access to the group's benefits with the HSA here, okay? Medicare is also a non-qualifier, or if you're covered on your spouse's plan, for example, if you're double covered and that plan's not an HSA qualified plan, you could not have the bank account here either, okay? So be mindful of that. So let's talk really quickly about what we can spend our HSA money on. What have you guys used your HSA dollars on, or what do you know is qualified? Don't be shy. Prescriptions, anything medical, that's exactly right. So anything covered under the health plan, we can pay for out of our HSA. Yeah, what else?
Your eyeglasses, contacts.
Perfect, thank you. So vision and vitamins is a great one. So see where it says OTC drugs? We're talking about over-the-counter medications or supplements, right? If you have a doctor's note that says you need to take those for a medical necessity, you can purchase them out of your HSA. Now, here's the easy way to manage that. Health
Most doctors say, "Oh, I don't get it from over-the-counter," so, they don't give me any note.
Right, so but the HSA, the IRS requires that you do have a note to buy it, okay? So here's what you do. Health Equity has a form in their library of documents. All you do is print that off. It's called I think it's an over-the-counter checklist, okay? Literally just itemize every single over-the-counter medication that you would possibly purchase for 2017. Take that to your first office visit at your doctor in January and have him sign and date it. It's good for 12 months from that date going forward, okay? And then file that with your records. That way, I mean, it sounds absurd, right? The IRS is saying get a script for ibuprofen. Am I really gonna go pay my doctor $60 to see him just to have him write me a note to go pay $5 to buy ibuprofen? It just doesn't make sense, right? It's a deterrent. But that's obviously the workaround, is that list will help you manage for the whole year, okay? And again, it can be for you and your entire family, all right? Okay, great question. So somebody mentioned vision, glasses, contacts, eye exams. Dental is another one, okay? We can use our HSA money for dental. And there's also some alternative things like acupuncture, chiropractic care, massage therapy, if it's also medically necessary. So if you just like to go like I do, because it's my happy place, because it just makes me feel good, that wouldn't be something I can pay for out of the HSA, right? But if I got in an auto accident or I had back surgery and part of my rehab is for me to have massage therapy, and your doctor writes a note, you're not sending that doctor's note to Health Equity, you're not sending it to the IRS, you're filing it with your records. In the event you get audited, you have a note that deems those purchases medically necessary, and you'll be fine. Make sense? Did you have another question? Yeah.
Are there certain elective surgeries that would not be covered? Or
No elective surgeries are covered. So LASIK is obviously vision correction. That's, some people will like, isn't that elective? You're electively paying for that to get your eyesight corrected. Yes, but it's actually a line item that's covered. Okay, when I say elective, I'm talking about enhancements, reductions, things that are not medically necessary. Okay, it's the easiest, nicest way to put it. Okay, or like veneers. That's a good one. So eye correction, you're actually solving a problem. If you just want to look nicer, I'm sorry, veneers is not covered. More power to you, but you can't pay for it out of the HSA. Now, if you're getting a cavity filled, that's obviously a diagnostic issue. Yes, you can. Okay, so it's kind of the common sense meter, but that's where the IRS has this gray area with HSAs, and they say anything deemed medically necessary. That can mean many things, and that's a conversation for you and your doctor. Okay, all right. So a couple other key points about the HSA. Funds roll over year to year, so you never lose your money. There's a beneficiary on this account, so heaven forbid something were to happen to you, your beneficiary would assume ownership of this account. Your money is protected, it's FDIC insured. And what happens if you retire or leave STG? Does the money go back to STG that they've funded or what you've funded? Yeah, Rachel goes on a vacation every year. No, you don't lose the money, okay? The money stays with you. That is gifted employer money, obviously to support you all year long, but if you were to separate your employment here for some reason, that HSA would just separate from STG, but the bank account stays yours, okay? Yes?
So on the over-the-counter stuff, like goes with my card, like pharmacy stores, you won't pay for other stuff. If you have the phone, how do you get reimbursed?
So great question. Sometimes there is stores that have codings that will not accept an HSA card unless it's called IIAS certified. And that is prescription-based software where it kicks out over-the-counter meds. Not all pharmacies or grocery stores have that, but if they do and your HSA card doesn't work for your over-the-counter med, what you're going to do then is log on to Health Equity if you paid for it with your own money. Health Equity has a reimbursement option where you can send the funds directly from your bank account to your personal bank account. So you would just add your routing and account number there and send the funds. You can also send a check to yourself, but I believe it's a $2 or $3 fee for a check, but electronic funds transfers is free. Okay, and we did this last year. We'll do this again this year. We really like to do it first quarter. We'll come out and do an HSA brown bag session. Okay, so we can talk more about the how-tos, how to manage your money, reimburse, pay providers, and invest and all that fun stuff through the HSA. Okay, but you can call me too, even if you want to have that conversation before then. I'm happy to talk to you personally. That would be a whole hour on its own.
That's happened to me where, and my wife's money on the Health Equity, and you get funds within like 2 days.
Mm-hmm.
It's like, and it's fast. where the pharmacy didn't take their HSA card.
Yep.
So, but it gets refunded.
Again, so the wonderful message is medical is staying the same, you're paying less, and you're still getting the same amount of money in your HSA, right? So kudos to STG on that. So
the dental is changed.
yes, and we'll get to that. So the next benefit is your telehealth benefit through Teladoc. How many of you have used this benefit? Or we have a lot of shy people or a lot of people that don't know yet and are missing out. Okay, so let me recap what this benefit is, and then I know you guys, those of you that haven't used it are going to be so excited to use this. As members of healthcare, we sometimes have access problems, right? It might be 11 o'clock at night on a Saturday. It actually might even be in the middle of my work day and I have so much to do, but if I go to the doctor to get diagnosed for a sinus infection, I'm going to take 3 hours out of my day. Maybe it's the weekend and my kid comes down with pink eye and I have to take him to the urgent care because that's obviously the only place open outside of the emergency room, right? Sometimes we're stuck with these situations where it could cost us a lot of money to solve problems that are not life-threatening. And we call those acute care types of situations, which are listed there under the conditions that are treatable underneath the Teladoc benefit. We have a sore throat, we have an earache, we have pink eye, we have strep throat, we have sinus infections, bronchitis, cold and flu, right? These are 80% of what we have happened to us in a given year. And we have to go to primary care, urgent care, or emergency room. This benefit, however, bridges the gap and solves the access problem. This is an opportunity for you to have a doctor's consultation, either a phone call or a video chat with that doctor for these types of situations, okay? These are board certified. Again, they're not just nurses or, call a hotline doctor. It's not like that, okay? Teladoc does a very, very extensive screening before they will even panel a doctor to see their members, okay? And every single doctor that participates is an active doctor working in a practice seeing face-to-face patients. That's a requirement, okay? So what this does is, again, it allows you to say, okay, once you register, I'm gonna go online or my mobile app and request the consult. I get a call back or my video chat, then get that request come through, and I sit there and I'm having a virtual doctor's office visit. What's your symptoms? Tell me how you're feeling. The same questions you would get asked sitting next to your doctor is going to happen virtually, okay? If they diagnose you with something and prescribe a medication, they will send the medication to the pharmacy. And guess how much this costs you? $0. The plan is sponsored by STG, so the benefit costs you nothing, and the consult costs you nothing. Now, if you get prescribed a medication, however, the med will go through the health plan, and obviously you'll have to pay for the price of the medication. But again, the program and the consult is free, okay? We've had a lot of testimonials from STG employees that this has worked wonderful. That sinus infection example was me. I get them 2 or 3 times a year. I know when they're coming on, and it's lost productivity for me at work if I have to go take 3 hours to go just get my antibiotic. I did a Teladoc consult just from my office over my lunch hour, ran by the pharmacy, got my medication, and didn't skip a beat at work, okay? So there's some great benefits to you as employees, and then also things for nights and weekends. It's a great, great opportunity for you to get the care you need at an awesome price. So now think about your plan too, right? Everything's subject to deductible. We have completely redirected cost, and it's cost you nothing. So it's a fantastic, pairing to the health plan. All employees who enroll in medical will automatically be enrolled in this benefit, okay? So it's mapping to medical. All right, so dental, this is the new benefit. Now I will say new carrier, however, the benefit is staying exactly the same, okay? Same deductibles, same maximums, same coverage across the board, okay? Now with Dental Select, we did do a provider disruption analysis. And there is going to be about 10%, okay? So 90+% of the dentists we saw on the old network are on the new network. Some of you in this room might be in that 10%, and unfortunately that's just the way it goes when you have to make a carrier change. But we were still very happy to see that it was minimal disruption. I say that to point out that you need to check your dentist, okay? Go to dentalselect.com. This is the Platinum Network, okay? And see if your dentist is in the network. If they are, you're good. If they're not, you have a choice to make, right? You can find a new dentist, or you can continue to see your dentist and obviously get charged the out-of-network benefit, okay? And if you also, one other thing on that, if your dentist is out-of-network, if you send me their information, I can pass it on to the provider advocates team at Dental Select, and they do an outreach to these dentists to see if they want to talk about coming on their panel and contracting as a dentist, okay? No promises there. I've seen it go both ways. Usually there's reasons why dentists do or do not, and sometimes those reasons aren't going to change, but it's worth us passing it along if you want us to look into that for you, okay? So reviewing the dental plan, we still have a $50 per person deductible with a family maximum of $150. Now this is opposite of the health plan where this is a per person, right? So 3 different people have basic or major work, 3 different people will pay $50 in your family, but once the $150 is satisfied, there's nobody else that has a deductible to meet, okay? Our preventive care is still covered at 100%, so those are our annual exams, right? Our cleanings that we get at the dentist twice per year. But if at that dentist appointment we found out we have a cavity, that would be considered basic. So basic work is a cavity, and then major is crowns, root canals, denture is essentially everything else. So you would pay your deductible first, and then whatever percentage applies. And this is actually flipped. You don't pay 80%, the plan pays 80%, okay? So you would pay 20%, the plan pays 80%, and then major is 50-50. The annual max is still $1,000 per person per plan year, okay? And this annual max is the exact opposite of medical. Because like we just said a few minutes ago, right? When you reach the medical out-of-pocket max, what happens? No more, right? Covered 100%. On dental, when we reach that 1,000, what happens? We're cut off, right? It's the opposite, okay? That's how much Dental Select will pay out per person per year. Yes?
When you reach the maximum, is the dentist still required to bill you at the contracted rates?
Yes, great point. So if you still continue to see your dentist and still continue to get work there, you will still get the allowed amounts. You're just paying 100% of them. So you'll still get the discounted rates. There's just no Dental Select sharing in the cost of it. Okay, great point. And no waiting periods, okay? So you can obviously access care anytime all year long. Out of network, I caution you from going out of network. It's there, but the biggest thing we see that is really unfortunate is members get balance billed if you go out of network. Even though you have coverage here, Dental Select will pay 80% of a fee schedule for preventive, 60% on basic, and 40% on major. What it means by a fee schedule is that's their contracted amount. So if their contracted amount for that preventive care exam is $100, they're going to pay 80% of $100. If you get billed $200, guess who gets to pay the other 20% plus the extra $100? You do, okay? So that balance billing is non-negotiable. They are not forced to write it off because they're not in the network. Make sense? Okay, questions on the dental? Okay. Vision, we're maintaining this benefit with Principal and they use the VSP network. This is for those of you that need hardware. So you have a $10 eye exam. Now this would be obviously an enhanced eye exam. A lot of the ophthalmologists and optometrists require that you do an eye exam with them before they'll write you a vision prescription. So even though you get an eye exam with the health plan, a lot of times you need to still do it through the vision plan with your again, your vision doctor. So check on that. But it's a $10 exam copay. And then you have a $130 allowance to be used towards frames or contact lenses, okay? It's not both, it's one or the other. So you have that bucket of 130, and in the given year, you get to decide how you want to use it. If you choose to use it towards your frame purchase, your standard plastic lenses will also be a $25 copay. If you choose to use it towards your contact lenses, it's just a flat 130, okay? So you can, obviously simple math, if your total bill charges were $200, you're gonna get a $130 allowance and you would just only pay $70, okay? LASIK does have a $250 off per eye discount, and that's the max discount we see. Depending upon the retailer or again, the private entity you're going to, it can even be a little bit less than that, okay? So my encouragement to you, especially with the holidays around the corner, we see a lot of like Hoops Vision or Eye Institute of Utah running big promotions that sometimes actually will exceed your vision benefit, okay? So if you're only taking the vision for the LASIK correction, I would have you shop around a little bit first and weigh those options, okay? And then the other couple quick things about this is the additional features for your frames like scratch or tint resist, scratch resistant or tint or polycarbonate. Those are going to be additional copay costs, okay? And then after you use that $130 allowance, you will still continue to get additional discounts up to 20% if you have more purchases throughout the year, okay? Yes?
You can get the once a year from the DSP.
Mm-hmm.
You have to wait the full year. Sometimes you can get this or.
You know, I'm gonna make sure, I don't believe so, but we got asked that a couple times and I would hate to be misinforming you. My gut says no, but will you make a note to double check that? So I don't think so. Dental, yes, with your cleanings, but vision purchases, I don't believe so. And we'll just send a blast out to employees on that, okay? So quote me on that after we verify. Okay, so the next benefit to review is your life insurance and your AD&D. Can anybody tell me, what does AD&D stand for? That's right, accidental death and dismemberment. So STG, of course, is committed to taking care of their employees. This is another thing that just shows that, and it's very evident that they care, right? Heaven forbid something were to happen to you, this basic life insurance, 100% provided by them, 100% paid for by them, they will give this to your beneficiary, okay? Your beneficiary will receive the equal amount to your annual salary. So 100% of your annual salary with a minimum of $35,000 and a maximum of $200,000. Very generous, very nice financial, peace of mind for your beneficiary if you're not here. Having said that, that's sometimes not enough if you think about not being here, to provide for the family, to take care of the kids, do all those things that we do as husband and wives, right? The voluntary life insurance affords you an opportunity to buy additional life insurance on top of the basic, okay? So you're gonna get the annual salary from STG, and you can personally purchase up to $300,000 in additional vol life, okay? For the new hires, I think there were a couple in the room, you have a one-time offer to take advantage of the guarantee issue, which means you still have to pay for the $130,000. However, there's no questions asked, policy is yours, okay? The rest of you, whether you are not a new hire or you are, if you want anything up to that $300,000, you are subject to an approval or denial process, okay? So there's a form you have to fill out, a past medical questionnaire, and then principal will either insure the policy or deny it based upon that assessment, okay? For spousal basic, if you were to lose a spouse, you will receive $5,000. And if you want to buy additional spouse coverage, it's up to $150,000, not to exceed 50% of what you purchased on you, okay? And then for children, STG provides a benefit of $1,000 for kids up to age 6 months, or 6 months or older, $2,500. And then there's a one-time offering of $10,000 of child life in addition to that as well. So like I have 3 kids, you just pay one flat fee, but heaven forbid you were to lose more than one child, it still will pay out the $10,000 for every child, even though it's one child fee, okay? Can't stress enough how important the guarantee issue is for new hires. If you've ever tried to get life insurance, street rates, what we call them, right, retail pricing, it's easy to get denied, okay? So this is a great opportunity for you to take advantage of that. And then even if you're not a new hire, no harm, no foul to try, right? But I will say, be careful with, the amount that you put, because obviously the higher amount, the more questions they ask, right? You might have to go get a physical, you might have to do, other testing, and they will send you those letters to tell you what's required. Questions? Yes.
Can the beneficiary of the life insurance be a trust?
Uh-huh.
Does the online form allow for that?
It does. It allows for a trust entity or a person. Yes. So the question was, can we put a trust? So let's talk about beneficiaries, because that's a couple other quick things on this. We, unfortunately, at Spectra have paid out beneficiaries. In the last year, I've paid 2 that did not go to the right person. If you are legally married, it will be your spouse, but your spouse still needs to be your written beneficiary. I've seen people be divorced and get remarried, and their ex-spouse is named as the beneficiary. It won't automatically pay to them, but what does happen is it will get held up with the probate department of the state for 12 to 18 months as they sort through that situation. If you put a child, a minor under the age of 18, they won't touch the money until they're 18, okay? It will go to the probate department of the state, and then they will get the disbursement at age 18, okay? I was a single mom for a long time. Before I got into insurance, I didn't know that. I had my 1-year-old, my 2-year-old as my beneficiary, thinking, oh, if I were to pass away, she'll get that money. No, she wouldn't have. So then once I realized that and learned that, I put my sister as my beneficiary, because that's who I willed my daughter to in the event I passed away, okay? So if you're a single parent, that's the way you want to do it, or you can do a trust, okay? If you're legally married, again, it has to be your spouse, Or if you're not married and you obviously just want to put somebody down, just make sure you have the right person, okay? And check that at every open enrollment. And you can actually update that anytime all year long, okay? The most common occurrences I see with paying out the wrong person is people that are not married. So an estranged sibling or an ex-spouse or an ex-boyfriend or girlfriend or a friend that they haven't talked to for years. Those people like getting those phone calls and I cringe, okay? So please, please, please update your beneficiaries. And the other great announcement actually about this is one thing that the executive team thought was really important this year. And that we assess, how does STG fall in line with benchmarking data? How do you compare to your competitors? How do you compare to Utah employers? How do you compare to national data? And one thing about the basic life insurance was historically STG has always mapped that to those of you that were enrolled in medical. That was kind of a unique way of doing it per se, right? So when they assessed best practices and are we doing the right thing, they felt like it was time to make a change, okay? So what they're doing now is actually offering the basic life to all employees. So even those of you that waive medical, you will be able to receive that basic life insurance policy starting January 1st. So great adjustment and enhancement that STG made. Okay, now a couple more things I'm gonna go over and then we're gonna turn it over to Des to go over your wellness. You have 2 voluntary disability plans that you can enroll in. The short-term disability plan is for those of you that were to be out of work for an accident or illness after 7 days. This will kick in paying you 60% of your weekly earnings up to $1,800 per week, okay? It will continue to pay you for a period of 12 weeks. Now, that 7 days though is included, it does apply towards that 12 weeks. So it essentially is 11 weeks of payout, okay? Now, if you come back to work, obviously before that 12 weeks, it will stop. Long-term disability, if you're out of work for 90 days due to an accident or illness, it will start to pay you 60% of your monthly earnings up to that $5,000 per month, okay? And it will continue to pay you until retirement age. Depending upon how old you are, that can either be 65 up to 67 and a half, okay? And again, the pricing there you can see it lists. Go to Benefit Compass, okay? Because it is based off of your salary and your age, and it will determine what your costs will be. Right. And the last benefit to review is the FSA. Now, we mentioned that HSA bank account is paired with the health plan, right? One of the IRS rules is if you have an HSA bank, you cannot have a full purpose FSA. So the first FSA option is for those of you that are not participating in the medical, okay? So if you waive the medical here, you can actually participate in the full FSA. What that means is you can set aside any amount from $1 all the way up to $2,500 to turn around and spend on your medical, dental, and vision expenses. Same thing as the HSA qualified list, it applies here for the FSA, okay? Now, that money is front-loaded at the beginning of the year, and then it's coming out pre-taxed equally all year long, divided into your 24 pay periods, okay? Now, for those of you that have dependent care needs, so kids in daycare for the purpose of work, you can set aside up to $5,000. It is not front-loaded, however. It's available to use as it's deducted from your paycheck, okay? Now, for those of you that are going to be participating in the medical, you can see that last bullet there. It says you actually, though, can choose to have a limited purpose FSA. And what limited means is it's restricted to dental and vision. So you would still have your HSA for medical, but you could use an FSA, again, any amount up to the $2,500 to set aside just for those 2 things, dental and vision. So a lot of people ask me, well, why would I do that? If medical can be used for medical, dental, vision, why do I need a separate account for dental and vision? And here's a quick couple examples. I've seen a lot of people that are doing big ticket items with dental and vision, LASIK or orthodontia, right? So I'm gonna put braces on my kids, or I'm gonna get LASIK done, or my spouse, or whoever it is in your family. You don't want to use the HSA money, and knowing the HSA is an accrual-based account, it might take you a while to build up that balance before you could pay for something like that. These, however, remember, are front-loaded. If I'm getting LASIK done and they tell me it's $2,000, I can elect $2,000 in this limited, and it's available to me January 1st. And then obviously you're paying it back all year long. So it's a nice way to have access to this money, and then obviously, you know, not touching the HSA money. The other reason I see that people do that is simply just optimizing their HSA dollars and having them roll over and just preserving it. So they're not worried about cash flow. They just think on average, I spend about $500 to $800 maybe on dental and vision. I just want to do it this way, so I just leave my HSA alone. for that obviously to roll over year to year and to build that nest egg. Okay, questions on that? All right, it's all you. Oh, sure. Oh yeah, so actually one benefit that we didn't put in we should have put this in the PowerPoint, is a reminder on the EAP. So it is in the benefit book. We have some books over here if you want to take one, but it's also in Benefit Compass. STG provides you this employee assistance program through Magellan. This allows you to use it for you and your family members. So anybody living in your household, you get unlimited telephonic consults, and you're dealing with, these are psychiatrists, psychologists, these are certified therapists, that's the word I'm looking for, that you're talking to, okay? And things like money management, marriage counseling, addiction issues, you know, there's so many different categories or topics that you can talk about. Again, the telephonic consults are unlimited, and you get 3 in-person visits per year per person, okay? So again, that's something that STG provides to you that you can take advantage all year long as well. Thanks, Des.
Anytime. Thanks, Heather. So I'm going to talk a little bit about our wellness program. How many of you are signed up already for that? All right, perfect. So in April of this year, we partnered up with Telehealth to help facilitate our wellness program. You should have all gotten an email this morning. If not, I can resend that to you of how to log on to the website if you have any questions with that. And I will walk you through that. As part of this, it's for all of our employees, whether or not you're taking our benefits, if you're part-time, if you're full-time, doesn't matter. If you're with our STG family, you're included in this. It's absolutely free for you. And does anybody know what the biggest perk of that is? Gift cards, what?
Gift cards.
Yeah. Has anyone been able to get a gift card from this? Wait. Yeah. Yeah. So there's a lot more gift cards out there for you if you want to try to get it. So when you log on, the first thing that you'll probably want to do is our health assessment, because it's going to go through, it's going to be specific questions for you. It's going to ask you many different questions, and depending on your answer, it's going to develop these digital coachings. Those are separate, where you go on and it's going to ask you more questions to fill out with your health, and then give you coaching based on those questions. And then the core challenges, we have 4 each year. We're only doing 3 this year. So the Fit and Festive started this Monday. You should be able to still sign on for that. If not, let me know. And they're usually 200 points each. But this time, because we want to incentivize you to get out there and enjoy it, we're actually offering 400 points for this core challenge. And then, and there's other things that you can do as well. So if you have your preventative exam, flu shot, this actual, the open enrollment is 200 points. So just by attending this, you already are really close to getting a $25 gift card. So congratulations. And there's a lot of different opportunities on that to earn points towards the gift cards. And then gym reimbursement for next year. So if you know, for this year, we have every month that you can utilize your gym of your choice. 8 times or more, you get $25 incentive, which is expensed. Next year, Jeff is awesome and has approved that it will go from 8 to 4 times. So just go once a week and you get that $25 incentive. Any questions with the program itself or anything like that? Yes.
I know that you said that the internet, I didn't try it, I should not be lying. But definitely this Friday, I will try. Hopefully I'm not wrong, because I don't know, anytime I enter my email, I entered my STG email.
Okay.
Correct. So all the time it said, your account has been locked. I didn't try it. I said it that one last time.
Yeah.
But this Friday I will try. If it's not, I will come here.
Okay. Yeah. You can notify us as well. So and that's a good question too. So when you log on to your Select Health website, on the right-hand side, there's going to be a My Health login. You put in your information for that. If you do not have our benefits, you can reach out to the benefits team and we'll give you your specific ID number. So you'll plug that in and you can enroll in it, and it doesn't matter if you have our insurance or not. So you plug that in and then you can start that process. If you forgot your password, you can say you forgot it and then walk through those steps. And then, but it will lock you out after a certain time, and I can give you the number for that, a specific person to help you with that. But yeah, that's great. So if you don't have our insurance, let us know. We can give you that specific number.
For the gym, does it have to be a gym, or can it be someplace like a karate studio or jiu-jitsu?
Yes, that's a great question. So as long as you can prove your utilization, so even if you go to like, I don't know, like
Yoga
a
studio.
yoga studio, yeah,
Zumba,
yeah, they,
karate.
yeah, they should have a utilization report. If not, you can put the dates on there and have them sign off that you have attended those. So some type of proof that you're going. Any other questions? Okay, we'll turn over to Mike for the talking about our tools.
Okay, like Heather was talking about before, how STG got a rate reduction, and that is because you had less claims going out than this year than you did last year. So all we're talking about here is all these carriers that STG has picked have tools to help you manage your care. I'm going to tell you really two quick stories because I know you've been here a long time. 20 years ago, I had, in my family, had premature twins. Okay, so and they came in November. In 2 weeks, it'll be 21 years. They came in November. They stayed in the NICU in November into the next year. I paid a total of $4,000 out of my pocket. When all is said and done, their total bills together were a little bit north of $500,000. So I paid for Intermountain Healthcare. I was on Select Health at that time, paid over $500,000. STG has put together a benefit program to protect you and your family for any kind of illness. It's unbelievable protection on the medical, the dental, life, disability, and everything. So you may have like 2 or 3 office visits, then something happens. These STG has put together a wonderful benefit. The other things, tools. Like Heather, I get sinus infections all the time. I went to my doctor, told him I'm tired of this. Give me something. He writes out a prescription. I just took it, went to the pharmacy to fill it. The pharmacy came out and said, "Did he tell you how much this costs?" I said, "No." It was a little bit over $300 for one prescription. The pharmacist looked at me and said, "Amoxicillin will do the exact same thing for less than $5." So you have tools with Select Health and others that where you manage your claims, manage your office visits. When you go to the doctor and he prescribes you a visit, interact with them, talk to them, ask them, is this the best thing to do? A couple other things that you have on the mobile app is where you can look at prescription. You can find hospitals, clinics, pharmacies, everything. One thing, you have the Walmart, Walgreens, Smiths, all that to fill it. Right now, Intermountain has their pharmacies and their clinics and all that, even in the hospitals. As a Select Health member, if you go to those, you get preferred pricing.
So one thing I want to point out really quick, just to make sure we emphasize this. We've talked about the mobile app for a couple years now, right? Hopefully all of you know it exists. Really kind of the new thing that we want to point out is the Intermountain Health Hub, which does something a little different. What it's doing is allowing you to see wait times at Instacares or even refill prescriptions right there and check statuses of them, as well as paying your Intermountain Healthcare bills, okay? So it has some other things that you cannot do on the mobile app that you have to do on the Health Hub. And that's another app that you just download from the App Store, okay?
Yeah, so there's just a ton of tools to look at. The other thing, pharmacy. Right now, as we went through this whole renewal process with STG, pharmacy right now is the biggest, probably one of the biggest expense in any benefit program. Always talk to your doctors about the pharmacy. If he's prescribing you something, say, is this the best? Is there any alternative that's cheaper and all that? Talk to them so that you can interact and make sure. Again, if you go to the IHC clinics, your pharmacy will be cheaper. I just had a minor surgery about a month ago. Usually I just would go and fill it at, I go to Dick's Market in Centerville. They did it right there. They said I probably saved about $100 on pharmacy just by getting it filled. And there's pharmacies in the hospital. You can walk into the hospital, LDS hospital, and get it filled right there. So just tools to look at and all that. The other thing, member advocates. Right now, like Heather was talking about the specialists, you can have anywhere from a 3 to sometimes a 6 week wait to get into a specialist. If you get something and you're diagnosed and you need to see a doctor, you have member advocates at Select Health where you can call them. They will search out and they may even find you and make an appointment for you if you need to. That's just another thing that you can look. There's a number and they're even open on Saturdays. So if you have an emergency on Saturday, you can call the member advocates. Quit for Life smoking. If you or anybody in your family, you have that program. Out of area service. This is important because if you're in Disneyland or on vacation and something happens, you have out of service coverage. And you have the ability to go to what they call multi-plan and PCH networks that have contracted with Select Health to get a better benefit, okay? And then Healthy Beginnings. Anytime, if you're expecting a new baby or planning on it, you can get into this program, Healthy Beginnings, and it gives you a ton of information. Just like with my family, I had no idea. Well, first of all, when they said I was going to have twins, I had 2 girls. And I said, okay, I'm going to try for a boy one more time. Went, they did it. Guess what? Twin girls. So love them, but it's good. But now it's like they cost me $500,000. But go to Healthy Beginnings. It's
President of the United States.
but yeah, I know when the older I get, I'll be taken care of because I got 4 daughters now. But the Healthy Beginning program gives you a ton of information to keep it on top of that because you just never know.
And you can earn gift cards
Yes.
in the States that are even cash rewards, so it's pretty cool.
It's not included if you have a new pet.
And then, okay, benefit compass.
Yes.
But anything, the other tool that you have is Heather and I, and you have Rachel and her team, is if you have any questions, reach out to us. We're here to help you navigate through this whole thing. And Heather and I, I'm not going to get on my political soapbox, but what happened this
We don't
week,
see eye to eye. That's what he was going to say.
we know for a fact, healthcare is going to change again. We have no idea what's going to happen, but it will change. So you have a great team here at STG to help you out.
Awesome. So one thing I want to emphasize is the out of area service for dependent children. So again, you have access to those networks if you're traveling on vacation, like Mike said. But if you reside here and maybe have a missionary or a college student or somebody that, for an indefinite amount of time lives somewhere else, those are the networks as well that they will access all the time outside of Idaho or Utah. Okay. If you have a child that is international, however, the plan only covers emergent care. Okay. And you have to pay for it in full wherever you are, bring back all your receipts in the paper trail and submit for reimbursement to Select Health. So just want to make sure you guys understand that difference. Okay. So now where do you go to make your changes for this year? What's the name of the website? SpectreBenefits.com, and we call it Benefit Compass, okay? So hopefully this looks familiar to you. You're gonna log in with your username and password. If you forgot your password, there's a link to reset that. And then once you get in there, it looks a little bit different now. It's actually had an upgrade to the look and feel of it, but you will still have a welcome message for open enrollment and then a start button. And that will start the process to first verify your employee information, save through it to make sure it's correct or updated. Make sure we have the correct information for all of your dependents. And it is required to provide social security numbers, okay? So if you are adding a new dependent, make sure you have that to input. Once you've verified that, then you're simply gonna go through each benefit and elect what you want and assign the right dependents to those coverages, okay? So when you're going through this step by step, I know this is hard to see, but there's little green check marks that are going to appear after you've completed each section. If you get to the last summary page and that a green complete button is not green for you to click and it's grayed out, that means you've missed something. So look for a missing green check mark, go back to that section and save through it, okay? And then you will be able to see an overall summary of your elections and then obviously execute your electronic signature agreeing to those elections. The other thing we want to point out is when you log in, you will have a separate little notification there that says required tasks. So STG uses Benefit Compass also as a way of communication for some items. There's an updated consultant handbook, correct? That you need to go through and acknowledge that you've read that, right? Read it word for word and then agree and complete, okay? So there's a couple things, housekeeping items, so make sure that you pay attention to those. We're leaving Benefit Compass open until November 20th. So you have plenty of time to go in and out as many times as you want. Call us if you have questions, reach out to HR. Again, we're here to help, okay? But at midnight on the 20th, the site closes, and whatever you've elected at that point, we'll push through for January 1st. Okay? All right. Oh, and really quickly, the what's missing, don't forget, those of you that are going to elect voluntary life insurance, it will prompt you to download the health app questionnaire that you need to complete. And also we have additional resources on Benefit Compass. As an employer, they're required to put CHIP notice, Medicare D notice, exchange notices, things by law that you need to have access to. They're all online. We also have links to the provider directories, to every carrier, our information, email, phone number, it's all there. Okay, awesome. Well, we'll stick around if you guys have questions and want to talk to us one-on-one. And again, our information's in the book or online if you want to call us or email us another time. Okay, thanks for coming.
I also want to say too, real quick.
Yes.
So Scott Cheney is here as well for our 401k. If you have questions about that, he's here to answer your questions. We are going to have separate 401k meetings in January, separate from this. So you haven't missed an opportunity. We just wanted to keep them separate. So if you have questions for Scott, he's here. And he'll be at every one of our open enrollment meetings just in case. I have a open enrollment book, benefit book, if you guys want to pick one up on your way out.
Yes. My name's Heather Spencer.
Thanks,
My
everybody.
information, let me show you, actually, if you turn the page.